In this discussion of ours, today we talk about the scapula, right? So, scapula, obviously, I think we all know it's an upper limb bone, and it's also called the shoulder blade, right? So, one thing which used to confuse me initially when I started reading scapula at the very beginning of first year was how is the scapula actually oriented? This should not be a confusion. It's very easy a bone, but it did create a confusion for me. So as we can all see, this is how the scapula obviously looks like, right? The first thing that we need to do here is to differentiate what aspects are we really viewing the scapula from, what view we are actually having of the scapula, what are the features of the scapula as a bone. Then we will move on to the attachments of the scapula, and finally some clinical anomalies related to scapula. The view that right now the scapula is oriented at is the anterior view. So you're seeing the scapula anteriorly. This is not placed anatomically, by the way. This scapula is not placed in anatomical position. Merely I have placed it on a flat surface to give just a idea of how the anterior surface looks like. This is a rough idea of how the posterior surface looks like. So immediately we can see that the anterior and posterior aspects of the scapula, I wouldn't necessarily say surfaces, they are distinct enough to really appreciate the difference between them. So as far as the features of the scapula are concerned, it has got this surface, which is the costal surface or the anterior surface, and this posterior surface or the dorsal surface. Okay, costal because it is facing towards the ribs, obviously we know, and dorsal because obviously it's dorsally placed. Okay, so these are the two surfaces. Now, as far as the borders of the scapula are concerned, scapula is a triangular bone. It is a triangular bone. So there are three borders. This is one border. This is another border. This is another border. I'm not mentioning which border is which because we haven't determined its side yet. But we can clearly say that this is the superior border because the scapula, whether this is the superior or this is the superior side, that should not be a confusion. Whether this is the medial side or the lateral side, that can be a confusion, but not the superior inferior distinction, obviously. So this is the superior border, really. No problem with that. But which one is the lateral border and which one is the medial border? Here we need to remember one thing. That thing is that the lateral border is incredibly thick. It is in fact the thickest border of the scapula, whereas the medial border is comparatively a lot thinner. Also, you can see that on the lateral side, this oval, you might say, depression is present. This is nothing but the glenoidal cavity or the glenoid cavity, right? This is for, rather this is meant for the articulation with the humerus. We all know that. So this is laterally oriented. So this is the lateral border, which is very thick, the thickest of all the borders. This is the medial border, and this is the superior border. So automatically we have determined which sided scapula this is. If this is the lateral border, then obviously this is the right scapula. No confusion in that. But even then, even when we have determined its side informally, we need to list some points as to what determines the side of the scapula. So for that, the first point I've already given you. That is, the lateral border is very thick. It is the thickest of all borders. First point. Second point, the glenoid cavity is laterally placed for articulation with the humerus. Second point. Third point. Now we know what the lateral side is, what the medial side is. But as of now, we still do not know whether this is the anterior side or this is the posterior side. So I kind of took it for granted that this is the anterior side or this is the costal surface. How did I say that? By a very, very distinct plate, triangular plates presence on the dorsal side. What is this triangular plate? See, triangular. This is called the spine or the spinous process. There are a lot of processes in scapula as well. We'll talk about that in a bit. So the triangular plate-like spinous process is present dorsally. So obviously this is the dorsal side and this is the costal side. Which one is the lateral border? This one. Why? Because obviously this has the glenoid cavity and also because this is the thickest of all the borders. And this is the medial border. And obviously this is the superior border. Right? So that completes side determination features for scapula, number 1. And we also get a quick overview of the borders of scapula. Right? Right. Now, what are the other features of scapula? So we talked about the borders of scapula. Let's very quickly talk about the surfaces. Now, I said that the anterior, this is the costal surface of the scapula. See, the costal surface, how it is marked by these longitudinal ridges. Can you see? These are very finely running longitudinal ridges. From medial towards the lateral side, it's going like these. And this is a very thickened portion adjoining the lateral border. So this is the lateral border. Adjoining the lateral border, we also have a very thick ridge which is running on the costal surface. What are these longitudinal ridges meant for? Why are they present on the costal surface? So we will see when we will talk about the attachments that there is this one muscle called Serratus Anterior. Right? So Serratus Anterior, what happens is that it uses this thick ridge that I just mentioned as a lever for its action, which is overhead abduction of the arm. Overhead abduction. I hope you know what abduction and adduction is. So for overhead abduction, we need Serratus Anterior, and for Serratus Anterior to act, this thick ridge adjoining the lateral border acts as a lever. As far as the movements concerning the you might say shoulder girdle is concerned, we will see to all the movements and the muscles concerned with them when we study shoulder joint. Right now it's beyond our scope. Okay, so fear not, we'll talk about that later. All right, so that's all about costal surface. What about dorsal surface? As I mentioned, dorsal surface has this very distinct triangular plate-like process called the spinous process, or the spine of the scapula. The spine of scapula divides the dorsal surface. This is also dorsal surface, by the way. See, this entire thing was dorsal surface. Then spine got attached like this. What it did was, it divided the entire dorsal surface into the supraspinous, see how logical the name is, supraspinous and infraspinous fossa. So these are two fossa present on the dorsal surface of the scapula, created due to the joining of the spinous process with the dorsal surface of the scapula. So right now what you're seeing is a superior view of the scapula. This is the supraspinous fossa, as you can very well appreciate, and this is a very larger infraspinous fossa. Now, when I was mentioning about the side determination, I mentioned in brief about the borders of the scapula, right? So, as far as the borders of the scapula are concerned, this is the superior border. Now, let me tell you something. Do not consider spinous process as a part of scapula when you're determining the borders of scapula. So, I have also been confused as to how scapula is triangular, because it looks very irregular, right? In the superior aspect, it is looking very irregular. So how is it that we are telling that the scapula is triangular? The reason is very, I might say, simple. Do not consider spinous process as an inherent part of scapula. Rather, consider it as an attachment to the scapula, as if spinous process is another bone which during the course of evolution got attached to the dorsal surface of scapula. So if you remove spinous process, then imagine scapula, you are left with a triangular plate. See, a triangular plate. And coracoid process also is somewhat like that, like the spinous process, got attached to the scapula. So really excluding these attachments, or really excluding these processes, we are left with a triangular plate of bone, which, since it's triangular, has three borders, as I mentioned: the very thick lateral border, the superior border, which is the shortest, by the way, this is the thickest, this is the shortest, and this is the medial border, which does not really have any distinguishing features as such, right? Now, since it's three-sided, it is also triangular, that is, it also has three angles. So what are the angles? This is the inferior angle, obviously this is the inferior angle. Which one is the superior angle? Here, this is the superior angle. It's a bit broken over here. My scapula is a bit broken over here, not my scapula as in that, but this model here is a bit broken. But over here we have the superior angle, this is the inferior angle, and you might actually think, where is the lateral angle? Because there is a lateral angle. We consider this entirety of the glenoid cavity adjoining part of the scapula as the lateral angle. So do not think that there are only two angles, because these are two sharp meeting points and there is no lateral angle. No, there is a lateral angle. We do consider this entire thing as a lateral angle. Just because it is thick does not mean that it's not an angle. Okay. Now, very interestingly, these angles are covered by they're actually covered by substructures or some muscles actually. Although we will see to them when we talk about the attachments of the scapula, let's just mention them. So inferior angle, this is the dorsal side. It is actually covered by a muscle called Latissimus Dorsi. Now Latissimus Dorsi is a muscle of the back, and it's a huge muscle. So Latissimus Dorsi actually, it starts from the inferior angle of scapula. So it covers the inferior angle. As far as the superior angle, that is concerned, superior angle is covered by the trapezius. Trapezius, if you know, see, this is the scapula, this is the dorsal aspect, right? So scapula is the shoulder region, right? Roughly speaking, is the shoulder region. So above you are having the neck. This is the neck region superiorly. Superiorly, the neck region, then the head region. So in the neck region, dorsally, we have the trapezius, which is triangular like. So it covers the superior border of scapula. Okay. Now let's talk about the next feature, bony feature of scapula, that is the processes of the scapula. So I've already mentioned that this is the coracoid process of scapula. This is in entirety the spinous process of scapula. And here we have an acromion process. Acromion process is actually continuation of the spinous process, right? See, superiorly you're seeing that this is the acromion process. We all know that it articulates with clavicle. Anyways, so that is actually continuation of the spinous process itself. This is the coracoid process, right? Okay, so that's more or less about the processes of the scapula. Now let's talk a bit, before we move on to the attachments, a very small bit about the spinous process. Why? Because spinous process has very interesting attachments. So as you can see, this is the dorsal aspect of the scapula, since we can see the spinous process. So spinous process is triangular, so it has three borders as such. This is the one border. This is in entirety a posterior border, and the way it is attached to the scapula, that is the other border. Are you getting me? See, what you see right now is the posterior border of the spinous process. Posterior border of the spinous process is this huge, thick, then it is expanding into the acromion process, right? So posterior border of the spinous process is also called the crest of the spinous process. It has two lips, as you can very well appreciate. This over here is the inferior lip, and this is the superior lip. The superior lip is continuous with the medial border of the acromion process, because obviously this is the medial side and this is the lateral side. For confirmation, you can see that this is the glenoid cavity, so lateral side. So this is the medial side of the acromion process. This is the lateral side of the acromion process, continuous with the outer lip of the acromion process, and this is the inner lip of the spinous process. I mean, this is the inner lip of the spinous process, this is the outer lip of the spinous process. All right, fair enough. Okay, now the upper lip and lower lip, or the inner lip and outer lip. Now as far as the coracoid process is concerned, coracoid means crow's beak. See how it looks like a beak, right? It looks as if it's the beak of a crow. Its epiphysis is atavistic type of epiphysis. I'm not going to any kind of details because we'll talk about it when we talk about general anatomy. But atavistic type of epiphysis, one of the few examples of that is the coracoid process of the scapula. Okay. Now, having talked about the processes, having talked about the borders, having talked about the surfaces, now, and also having talked about the angles. Okay, now we are in a position to name a few attachments of the scapula. Let's start from the costal aspect. Okay, so this is the costal surface, right? This costal aspect, this costal surface, this is also acting as a fossa. See, it's actually kind of a depressed area. You can see how this part is raised. So this entirety of this area is a fossa. This is called the subscapular fossa. Why it's called subscapular fossa is because the subscapularis muscle, which is multipinnate by the way, arises from the subscapular fossa, or rather, to be a little bit more precise, arises from the medial two-thirds of the subscapular fossa, right? So medial two-thirds of the subscapular fossa, subscapularis muscle, which is multipinnate, by the way. Okay, which is the medial side, by the way? Which is the medial side? Very good. This is the medial side. So medial two-thirds. Done? Done. Then, okay, let me use a pencil now, because to name the attachments it will be a bit easier. Subscapular fossa done. Okay. Now, what about the borders? So, in the medial border, so this is the medial border. Along the medial border, on the costal surface, along the medial border, we have the attachment of what we say to be the serratus anterior muscle. So serratus anterior is inserted along the medial border of the costal surface. Right? Now there is a twist here. What is the twist? Merely saying that will not suffice. Serratus anterior is a pretty extensive muscle. So it has 8 digitations. It has 8 digitations, right? So the first digitation, where does that insert actually? Remember what this part was actually? See, I have another scapula. So this part, what is this part? This is the superior angle, right? So this part is a bit better in this scapula, that's why I showed it here. Anyways, so this is the superior angle of the scapula. From the superior angle of the scapula to opposite the root of the spinous process. Remember, this was the spinous process. It has this huge part where it gets attached along the dorsal surface. This is called the root of the spinous process. It's called the root of the spinous process, right? So opposite to the root of the spinous process, from the superior angle to along the root of the spinous process, there is this one digitation of serratus anterior getting inserted onto the medial margin along the costal surface of the scapula. Done. Then from here, that is from opposite to the root of the spinous process to, or rather along the entirety of the medial border remaining, there is insertion of only 2 more digitations of the serratus anterior. Now we have reached the inferior border, or rather, sorry, the inferior angle, excuse me. At the inferior angle, there is insertion of 5 digitations, the remaining 5 digitations of the serratus anterior. So, serratus anterior, 5 digitations to the inferior angle, 2 along the medial border up to the root of spinous process, and only 1 along the medial border from the root of spinous process to the superior angle of scapula. So subscapularis, and this is serratus anterior. Okay. Now let's come to the dorsal surface. This is the supraspinous fossa. As the name suggests, supraspinous, this will actually give attachment to supraspinatus muscle. Rather, to be a little bit more precise, again, medial 2/3 of the supraspinous fossa will give origin to supraspinatus muscle. Along with the supraspinous fossa, a little bit of the upper border of the spinous process is also involved in the origin of the supraspinatus. Okay. Again, this is the infraspinous fossa. Medial 2/3 of the infraspinous fossa including a little bit of the lower border of the posterior margin of the spinous process, this will actually give origin to infraspinatus muscle. What about the spinous process? So we talked about these two regions. Now let's talk about this region. Very interesting. Remember what was above this? Above this, what structure is there? Very good, the neck. Because this is the shoulder region. So above this there is a neck. In the dorsal aspect of the neck there is this huge muscle which I said was very good, trapezius. So trapezius will actually get inserted along the upper margin or upper border of the crest of spine, and as I said, this continues into the medial border of the acromion process as well. So this is one continuous line of insertion of the trapezius muscle which is coming from the neck superiorly like this and gets inserted like this. Done. Again, just opposite to that, we have the lower lip of the crest of spine, which will again give origin. So this was insertion because the trapezius was coming from above, but this will give origin to deltoid. Deltoid is a very common muscle, or rather very important muscle. So deltoid, what will happen is it will take origin from the lower lip of the crest of spine, and that line of origin will continue along the lateral margin of the acromion process. So that's that about the spine of scapula. Okay. Now we talked about more or less the costal, or rather the dorsal surface. We talked about that. Let's now divert our attention a little bit towards the borders of scapula and see what the borders of scapula are actually attaching, what the attachments along the borders are, right? So speaking along the attachments, or rather speaking of the attachments along the border, first let's concentrate on the lateral side. So let's start with the glenoid cavity. So glenoid cavity, it has this very interesting aspect towards it, that is both superiorly and inferiorly it presents two tubercles. This is the supraglenoid tubercle and this is the infraglenoid tubercle. Supraglenoid tubercle, that actually gives origin to the long head of biceps brachii muscle. The long head of biceps brachii. So biceps brachii is obviously a very popular muscle. So where does the short head of biceps brachii come from? That also comes from scapula. Where exactly? From the coracoid process. Where of this coracoid process? See, this is the long head coming out, right? Which aspect of the coracoid process is very close to the supraglenoid tubercle? This aspect. What is this aspect? Arrange it anatomically. This aspect. What is this aspect? This is the lateral border of the coracoid process. So, a very interesting way to remember the short head of biceps brachii's attachment or origin is to realize that the long head actually comes out from the supraglenoid tubercle. Short head, we remember it comes out from the coracoid process. Where of the coracoid process? The part which is very close to the supraglenoid tubercle. That is the lateral part of the tip of the coracoid process. See, it's logical enough, so you don't have to actually memorize it. Then again, speaking of tip of coracoid process, lateral part is giving origin to short head of biceps brachii like I mentioned. medial part on the other hand is related to, or rather giving origin to, another muscle of the upper limb, that is the Coraco Brachialis. Coraco Brachialis is also originating from the medial half of the tip of coracoid process, just like short head of biceps brachii was originating from lateral half of the tip of the coracoid process. Long head of biceps brachii, supraglenoid tubercle. Close to supraglenoid tubercle, you have the lateral half of the tip of the coracoid process. So from here you have the short head. Just opposite to that, that is the medial half of the tip of coracoid process, Coraco Brachialis. Now, to finish off coracoid process attachment, there is another muscle to which, or rather for which, we come a little more medially. Along the medial border, now not just the tip, the entirety of the medial border of the coracoid process, along with a part of its superior surface as well, we have the attachment of the the pectoralis minor muscle. So along the medial border of the coracoid process, along with some part of the superior surface of the coracoid process as well, we have the attachment of the pectoralis minor, not major. Major does not have anything. Pectoralis major has nothing to do with scapula. It has a lot to do with humerus, which we'll study later. Pectoralis minor, on the other hand, has a lot to do with scapula. So pectoralis minor, see, this is the costal surface of the scapula, right? So this is the anterior aspect. So shoulder region, so somewhere over here, look at my hand, that is this hand, somewhere over here you have the chest region. So in that we know pectoral region means chest region. So pectoralis minor is somewhere along here. It is moving on and attaching to this region like this, right? That's why its attachment is along the medial border of the coracoid process, along with a part of the superior surface as well. Pectoralis major, on the other hand, it is not that angulated, it's not that superior, rather it's like this, so it does not touch scapula, it actually moves on to insert onto humerus. We'll see to that later. That's pectoralis minor accounted for, and that's more or less the muscle attachments of the coraco, or rather the coracoid process. Okay. Now, supraglenoid tubercle is accounted for. What about the infraglenoid tubercle? Just like this gave attachment, or rather origin, to long head of biceps brachii, this will actually give origin to long head of triceps brachii. Okay, so pretty simple. Long head of triceps brachii from infraglenoid tubercle. Done. Now, let's move on. Since we have already covered the costal surface, let's move on to dorsal surface, lateral border. So, think about this. Along the dorsal surface, along both the lateral border and medial border, we have series of attachments. We have series of muscles attaching. So let's look at them one by one. Okay. So first we have the lateral border. See, along the dorsal surface, since costal surface does not have much to offer as far as the borders are concerned, except that Serratus Anterior attachment along the medial border that we already have taken care of. So now lateral border along dorsal surface. So this is now dorsal surface we are talking about. In the you might say upper 2/3 of the dorsal surface, along the rough portion adjoining the lateral border, upper 2/3, we have origin of teres minor muscle. So this is the glenoid cavity, right? So humerus is somewhere like this. So from here, teres minor is a muscle which is originating and it is moving towards like this, towards the humerus. And then it is inserting along the humerus, not going into the details right now. It's the teres minor. Interestingly, teres minor, it actually originates via two slips. Two slips. So between the two slips, like this, there runs an artery. There runs an artery. That is known as the circumflex scapular artery. That artery is called the circumflex scapular artery in between the two slips of teres minor, which is, by the way, originating along the dorsal surface adjoining the rough portion of the lateral border via two slips, upper 2/3. Lower 1/3, only lower 1/3, we have accounted for teres minor. So lower 1/3, we are accounting for teres major. Okay, so teres major actually arises from the lower 1/3 of the rough striff, again along the dorsal aspect adjoining the lateral border. Okay, and as I have already mentioned, inferior angle is, obviously we have talked about it, Latissimus Dorsi arises from the inferior angle. Okay, so teres minor, then teres major, then Latissimus Dorsi. A similar story of two minor and major muscles is recited over the medial border along the dorsal aspect as well. So teres minor, remember, it's superior, teres major is inferior. Just like that, along the medial border, we have the attachment of a muscle called rhomboid minor and rhomboid major. Again, rhomboid minor is the superior attachment, rhomboid major is the inferior attachment. Okay, so what's happening is rhomboid minor, it is, by the way, inserted, not originating, inserted. If you're confused about insertion origin, to play it safe, you can say attachment. All right, so rhomboid minor is actually inserting onto the medial border adjoining or opposite to the root of the spinous process. As I've already mentioned, this is the root of the spinous process, and the medial borders adjoining region adjoining the, obviously, the root of the spinous process, along here we have the insertion of the rhomboid minor, whereas the remaining portion of the medial border from the root up to the entirety of the really medial border, we have the rhomboid major insertion. So here we see a similarity. Both times we see that the minor one is superiorly attached, major one is inferiorly attached. But one very subtle difference is that teres minor had a very extensive origin via two slips, whereas teres major had a very small origin. Whereas rhomboid minor has a very small insertion, rhomboid major has a vast insertion. Now, what about this region? This is the region of the medial border adjoining the superior angle. Remember what covered the superior angle? The trapezius. But remember, we have already accounted for the insertion of the trapezius along this region. Then superior angle, or this region, is not inserted, or rather it's not giving attachment to trapezius. Although it is covered by trapezius, it is not giving any attachment to trapezius. Whereas inferior angle is covered and also giving attachment to Latissimus Dorsi. Again, a subtle difference, but connecting things, so it should become easier. So this region, actually superior angle, or rather from the superior angle to the region adjoining the root of the spinous process in the dorsal surface. This is actually giving an insertion to the levator scapulae muscle. Levator scapulae is again a neck muscle. So see, you're getting insertions here along this entirety of the medial border. You're getting insertions, whereas along the entirety of the dorsal border, or rather the lateral border, excuse me, you're getting origins. That's an interesting thing to note as well. And since you're getting insertions, the muscles are actually coming from above, so they are neck muscles, right? So levator scapulae is a neck muscle and it is inserted along this region. Just opposite to that, I had spoken of another muscle, that is the serratus anterior. Remember, serratus anterior's first insertion was again, it had a similar attachment like the levator scapulae, that is from the superior angle to the region adjoining the root of spinous process along the costal surface. And for levator scapulae, same thing but along the dorsal surface. Done? Done. So that's more or less the muscle attachments. Only one more muscle is left. See, remember, I had talked about the supraspinous fossa and the infraspinous fossa. Interestingly, I had forgot to mention this. You can see a connection between the infra and the supraspinous fossa. This connection. This notch-like surface, this is the Spinoglenoid Notch, because it is present between spinous process over here. I'm sorry if you couldn't see, I'm sorry. The spinous process over here and the glenoid cavity over here. So Spinoglenoid Notch, right? Right. And I talked about the superior border. I forgot to mention, again, you can see a notch-like surface over here. This is called the suprascapular notch, right? Because this is the suprascapular, above scapula. This is the superior portion of the scapula that you're talking about. So this over here, this is the suprascapular notch. Suprascapular notch, I actually recalled right now because this has an important attachment. What is that? Inferior belly of omohyoid, that is actually having its origin from the upper border, that is a superior border near the suprascapular notch. So the superior border near the suprascapular notch, we have the origin of the inferior belly of omohyoid. Omohyoid, we'll talk about that when we'll talk about the neck strap muscles, right? So that's the last of the muscle attachments. The last portion of the scapula is the ligaments attachments. So now we have the humerus with us, right? So having brought the humerus, see what are the ligaments that can be present. One ligament can be the coracohumeral ligament. Coracohumeral ligament. Another ligament can be coracoacromial ligament, right? Another ligament can be the coracoclavicular ligament. So if we bring in all these structures like this is more or less the shoulder girdle. So from coracoid process, you have ligaments to all these three structures. That is posteriorly present, this is the posteriorly present acromial process, the superiorly present clavicle, and again the humerus. Three ligaments accounted for. Let's very quickly talk about these three ligaments, right? So the first ligament that we talk about, let's talk about the coracoacromial ligament. So which surface of the coracoid process is closer to the acromion process? This surface, right? Or this side of the coracoid process. This side is the lateral border of the coracoid process. So remember, lateral portion of the tip of the coracoid process, that actually give attachment to the what? Short head of biceps brachii. Whereas the remaining lateral border is actually giving attachment to the coracoacromial ligament. So where exactly in the acromial process is the coracoacromial ligament attached? Very simple. That is the medial side of the tips. Since again, what I'm trying to find out here is which side of the acromial process is closer, the medial side. See, this is the tip, this is the tip, this side is the medial side, this side is the lateral side, right? This is the tip. So medial side of the tip of the acromial process to lateral border of the coracoid process. This you have the coracoacromial ligament. So for finding, or rather to guess, or rather to understand, rather, you don't need to actually memorize much because these are very subtle things. What you do need is a bit of common sense. So you need to kind of understand which surface, which border is closer to the structure from where you are actually initiating the attachment. By this logic, you will be able to predict the attachments of many structures, the subtle attachments. We all know that coracoacromial ligament, coracohumeral ligament, coracoclavicular ligament, acromioclavicular ligament or acromioclavicular joint, the capsule for that, what structures are associated with that. It's already given in the name. The problem lies with the subtlety with which we answer the attachments. Merely stating that this is coracoid process, this is acromial process between the coracoacromial ligament. You're correct, but you need to be a little bit more precise. Right? Precision is where the common sense starts, or rather becomes more important, because these things at the end of the day are very difficult to retain. They are very easy to replicate, but pretty difficult to retain. Anyways, so that's coracoacromial ligament accounted for. The next one was coracohumeral ligament. Right now our scope is scapula, so we are not going to the humeral attachments. Where exactly is the coracohumeral ligament attached? So coracohumeral ligament, if I attach the humerus over here, more or less this will be the thing. Do you see this? The nib of the pencil tip, that's actually disappearing under the coracoid process, which means that the coracoid process root is very close to the humerus. So root of the coracoid process is actually giving attachment to the coracohumeral ligament. Simple enough. Then we come to coracoclavicular ligament. Now this is a ligament which is very, very interesting, because this is a ligament that we also study when we study clavicle. Coracoclavicular ligament had two parts. There were two parts. One was the conoid part and the other was the trapezoid part. Conoid part was cone-like, trapezoid part was trapezium-like. Right? That's why the names. Conoid part of coracoclavicular ligament gets attached to the, or rather near the root. Really, okay. So near the root, you have the attachment for the conoid part of the coracoclavicular ligament, whereas trapezoid part, that is actually on the superior aspect, because clavicle, if I bring it on, this is the acromion process, right? So somewhat like this. So clavicle is what I'm trying to mention, or rather trying to show, is clavicle is superiorly oriented, right, to the coracoid process and to scapula as a whole, right? So this is something. So that's why along the superior aspect you will have the trapezoid part, and along the near the root you will have the conoid part of coracoclavicular ligament attachment. Next we have, since I was showing the clavicles attachment to the acromial process. So see, you probably cannot see it better, you cannot see it much here because it's been eaten away. So let me bring on my other scapula. Here it's pretty well given. So see, you can see that there is a facet on the medial aspect of the acromial process. This facet serves as the facet for the attachment of the clavicle to the acromial process. So the borders of this facet will give attachment to the capsule for the joint of that that is being formed. What is the joint being formed? Acromioclavicular joint. Right, acromioclavicular joint. The capsule for that is along the margin of the facet along which the attachment is taking place, which is present along the medial aspect of the acromial process. Okay, done. Also, talking about capsules and attachments and joints, glenoid cavity, obviously we know it attaches with the head of humerus. As I was already showing, this, if we bring it on like this, somewhat like this, okay, so this is somewhat the attachment. So glenoid cavity, head of humerus. So obviously, since it's a joint, the shoulder joint, which we'll talk about later in much details, the margin of glenoid cavity will give attachment to the glenoidal labrum and also to the capsule for the shoulder joint, which is the margin of the glenoid cavity. Both glenoidal labrum we'll talk about it. It's a special structure. Labrum is a special structure which is pertaining to the joint. Glenoidal labrum and the capsule for shoulder joint. Done. Now we talked about this suprascapular notch. Suprascapular notch is actually bridged by a ligament. That's known as the transverse ligament, converting the suprascapular notch into a foramen, the suprascapular foramen. Very interestingly enough, suprascapular foramen transmits the suprascapular nerve, whereas the suprascapular vessels will pass above the transverse ligament. So suprascapular nerve passes deep to transverse ligament through the suprascapular foramen, whereas the suprascapular vessels, they will cross above and they will not be transmitted through the foramen itself. But all of these, that is suprascapular vessels and nerve, will ultimately be transmitted through the spinoglenoid foramen, which is formed due to the spinoglenoid ligament bridging the spinoglenoid notch. Spinoglenoid notch is bridged by the spinoglenoid ligament. This is the spinoglenoid notch, if you remember. Supraspinous, or rather, I'm sorry, yeah, the supraspinous fossa and the infraspinous fossa communicated through this spinoglenoid notch, bridged by the spinoglenoid ligament to form the spinoglenoid foramen, which transmits both suprascapular vessels and nerve. So there is no discrimination in this case. Okay. That completes attachments of scapula, and that completes the overall entirety of scapula. One very interesting thing about clinical part of scapula is that remember we were talking about serratus anterior. Serratus anterior, as I had already mentioned, it is obviously a costal surface attachment along the medial margin. What will happen is, if there is a paralysis of the serratus anterior muscle, then there is this undue prominence of the medial border, which should not be the case. So what happens is, let me show you how scapula is held anatomically, which is a very important thing. This is the lateral part, this is the medial part. So this is the right scapula, right? So you have to hold it in your right hand. Now I'll give you a superior view. Do not hold the scapula merely like this. Hold it a bit angulated, like this. So it's not like this, it's not plain, it's angulated like this. It's a bit twisted. How so? That the glenoidal cavity faces laterally and a bit forwards, whereas the medial margin is facing medially and backwards. And hold it as if you're holding a gun, like this. So a little bit angulated like this. All right? Not this, this. Why I'm talking about holding it anatomically now is because of the clinical really symptom. That is, if serratus anterior, which is present like this, gets paralyzed, this border, which is not only medial but a little posterior as well, this will get unduly prominent dorsally, forming a condition called winging of scapula. Winging of scapula. Alright. Now winging of scapula, by the way, is a condition which occurs normally in children. That is, in children most of the times, winging is a very natural phenomenon. Undue prominence of the medial border through the dorsal aspect of the back of the body is a natural phenomenon in most children, but can also be a clinical presentation of the serratus anterior paralysis. So that's one very interesting clinical aspect of scapula, and that completes the entirety of scapula. Hope this has been of utmost help, I guess, and thank you for watching.